When I started practicing, I practiced internal medicine, which is essentially general adult medicine. And what I saw was the negative impact that sleep disturbances had on people's quality of life. Things like sleep apnea and insomnia can exacerbate medical conditions like heart disease and high blood pressure and diabetes. I became very interested in learning more about sleep simply because sleep, I think, is such an integral part of wellness and well-being. I specialize in adult sleep medicine, so I typically see patients who have obstructive and central sleep apnea, insomnia, narcolepsy, and circadian rhythm disorders and shift work disorder. I think one of the biggest misconceptions in sleep medicine is that the only treatment for sleep apnea is CPAP. And I think, unfortunately, a lot of patients stay away because they're afraid they don't want CPAP or they can't do CPAP. There are several very effective alternatives to CPAP, and our office offers many of them, including an oral appliance, surgical options. So I really encourage patients, don't think that just because you have sleep apnea, your sleep medicine doctor is going to say you have to wear a CPAP machine to sleep, that there are a lot of alternatives. A lot of times when I first meet people, they have been struggling with the sleep disorder sometimes for years, and specifically they end up seeing me because they're starting to have negative consequences in their life. For instance, they're falling asleep at work and their job is in jeopardy, or their personal life is really suffering. And a lot of times they're very skeptical about their ability to use a CPAP machine or their ability to sleep through the night. Once we're able to work together, implement a diagnostic and effective treatment plan for them, and then I see them in follow-up. You open the exam room door and you see someone sitting there with a huge smile on their face and they say, wow, I can't believe it. They tell me about how much their life has improved or things they're able to do that they weren't. I think that's really the most rewarding part of being a sleep medicine doctor, is seeing how much better people feel when they sleep well. One particular patient I can think of, he was actually falling asleep at work frequently, and he was really in danger of losing his job. He suspected that he had sleep apnea, but he really thought that he was never going to be able to tolerate a CPAP machine, and he never pursued it. Once he started having these struggles at work, he felt that he had no choice. And we did diagnose him with severe sleep apnea. And with our team here, he was able to really very quickly get acclimated to the machine, use it, and felt so much better. And when we saw him in follow-up, he was doing great at work. He was able to alternate his shifts the way he needed to, and he was really no longer in jeopardy of losing his job. He just said, thank you, I feel so much better. The nature of sleep medicine requires that you really have a thorough understanding of the whole patient picture and how their symptoms and other issues may be contributing to their sleep. So it's really important for me that I work very interactively and collaboratively with my patients. It's important to me that patients really understand what their diagnosis is, how we arrived at that diagnosis, and then what their treatment options are, and that we select a treatment that is going to not only be effective, but they're going to be comfortable with and be able to adhere to. So usually my initial consult and diagnostics with the patient are actually just the very beginning of my relationship with that patient, and typically we work closely together as they implement that treatment to address any issues that may arise, and we kind of both progress together towards the goal of getting them a good night's sleep.